Good afternoon. Thank you all for joining us. I do have our Department of Health Secretary Kim Malzum-Risden with me today. Again, I want to be very clear with the people of South Dakota. We cannot stop COVID-19 from impacting our state. What we can do is slow down the spread and do that through managing our public health. And remember, everybody, this is a marathon. It is not a sprint. And what we are doing each and every day by getting up and using personal responsibility and taking actions at the local and the state level, it is working. I want to remind you a little bit about some of the steps that we have gone through and that our first case was on March 10th. Since then, we made a decision to send kids home from school. We allowed our state employees to work from home and recommended that all businesses in the state do that as well. Did an executive order following CDC guidelines telling folks that they should be washing their hands regularly, that they should continue to have groups under the size of 10, that they should stay home. And if they weren't feeling well, that they should call their doctors. I'm so proud of South Dakota and all the actions that they've taken since that time. It made all the difference in the world. We are flattening our curve in South Dakota, and we are getting to a point where we will peak in coming weeks, and we will be prepared and ready and take care of those individuals that will need hospitalization or continued care from there. I want to talk a little bit about Smithfield in Sioux Falls. And I want you to know that when we respond to a situation like Smithfield and call it a hot spot, it requires a targeted, intense approach. Really right now, tied to the Smithfield facility is 70% of that county's cases. We have 438 employees there that have tested positive for COVID-19. We also have 107 other people that are their contacts who became positive because of being family members or friends or in contact with those employees that work at the facility. Those total people, the 438 and the 107, amount to 70% of the positive cases that are in Minnehaha County today. And that is by far the county that's being the most impacted by the virus. Now, our hot spot response has 6 different key parts to it. The first one is that we asked Smithfield to take a pause. We know from studying the science of the virus that that's incredibly important to deal with the incubation period, to give people an opportunity to go home and to heal, and to make sure that we're following CDC guidelines and mitigation efforts. We also do at the state level intense contact tracing. Now, a lot of folks don't really understand the depth to what that is, but our Department of Health employees spend hours talking with someone who has tested positive, finding out where they have been in recent days, who they've talked to, what places they may have visited. Every single person that they were in contact with within 6 feet of distance, we interview and we talk to, and we make sure that if they've been exposed to someone else, that we're reaching out to that person. This is an intense process, and then we log and calculate and keep track of all that data to make sure that we're isolating those who have been exposed and that they're taking precautions to make sure that we're slowing down the spread of this virus in our state. Now, the Department of Health has tripled the amount of staff that is working in this area of contact tracing. We will double that again by Friday as well. Now, we also have other family options that are available to families that are impacted by this virus. There are some families, we always give the recommendation that they go home after they've tested positive and to isolate in their home. Stay in their bedroom, stay somewhere separate, maybe in the basement from the rest of their family. Some families don't have that opportunity. So what our Department of Health does then is that they give them the opportunity to isolate somewhere else, typically, which is a hotel. We take care of that for them. We make sure that if they can't isolate at home, that they can do that in a hotel and protect their family and their community as well. That is something that we've been doing since the very beginning and is a standard protocol step that we follow. We also take advantage of public education. We make sure that that family, that community, those they've been exposed to, also are following CDC guidelines, that they know what they are, they know what the current recommendations are, and help them get the PPE or the protective equipment that they might need or feel that they need to help get facilitated through us. We also use technology. I know we do the contact tracing, but we've been encouraging the entire state to download the app Care19. This is an app that we were the second state in the nation to utilize that allows someone to download a free app and make sure that it is keeping track of everywhere that they've gone. If they do happen to test positive in the coming days, it would immediately give us all the information that we need to have on where they've been, who they possibly could have exposed to the virus, and save us hours and hours of time, and also give them the peace of mind that they're doing a responsible job protecting their family and their community as well. And also the last step in this situation with Smithfield is that I want you all to understand that this is a critical infrastructure job plant. That means that this plant here is incredibly important, not just to Sioux Falls, not to South Dakota, but to our nation. It provides our food for us. I've had a lot of folks, and I've seen some national stories written that a shelter in place would have prevented this outbreak at Smithfield. That is absolutely false. It is not true. A shelter in place would have had no impact on what happened at Smithfield. And that is because regardless of a shelter in place order had been in place throughout the state of South Dakota or not, this plant would have been up and running because it is exempted as an essential business that is a part of our critical infrastructure plan to make sure that we can put food on the table for Americans and people across the world. That is something that needs to be stated again so that we make sure the reporting is honest, it's fair, and it's accurate. Now, again, the mayor has made a couple of requests from me, and I want you to know that I'm going to continue to do what I've always said that I would do, and that is continue to keep perspective, to continue to use science and facts and data to make the decisions that impact the state and the people who live here, the people who entrusted me enough to give me this job, to be their governor through hard times, good times, and almost unprecedented difficult times like we see today. The two requests the mayor of Sioux Falls has asked of me, number one, was to issue a shelter in place for Minnehaha and Lincoln County. I am not going to do that at this time. I don't believe it's appropriate considering the data and the facts and the science that we have. I do know that the mayor has some tools available, and I know that that can be a local decision that he and the city council can take if they choose to do. But as far as me taking action to put a shelter in place there in Minnehaha and Lincoln counties, I will not be doing that today. Also, another request that the mayor has made of me was to set up an isolation camp in Sioux Falls. They asked it would be the size to hold 7,000 people in a location such as the Civic Center, the Convention Center, that also would have the presence of my National Guard there. I will not be doing that either. The reason for that is because of the protocol that I outlined for you earlier. That these folks that test positive for COVID-19, we work with each of them individually. We give them the opportunity to go into isolation at home where they're comfortable. And if they can't isolate there or they choose to isolate somewhere else, that we make other arrangements to put them in a hotel room somewhere where they will have privacy, not somewhere like a camp in a convention center with 7,000 other people. That is a decision that I will not be making at the state level, but if the local community and the mayor wants to pursue that, they certainly have that opportunity to do that as well. The last thing I'll touch on is our economic impact that we're seeing from this virus across the state of South Dakota. We have significantly lower sales tax numbers that we see coming in the door. We also have seen video lottery revenues dramatically impacted. I want to prepare you for the coming days where we will get numbers that will be shocking to all of you. We will have our March sales tax numbers be reported in April, and the first week of May is when they will come out and be available for us to look at a comprehensive picture of what we're dealing with since this virus entered our state and impacted not just people's health, but also our families, our businesses, and our economy. I want you to go to covid.sd.gov. I've included some tables and some charts on this economic impact that you can look at and use for information in the coming days so that we can have a discussion on how we move forward as a state to not only make sure that we're healthy, but also that our families are healthy and that they keep a roof over their heads and continue to be successful and live here for generations to come. I want to continue to encourage you to go to covid.sd.gov. Every day we're adding new information there, new tools there. I would ask you to continue to use that as a resource. A lot of the questions that my office gets asked, a lot of the questions that the Department of Health gets asked, they're already there on the website. And obviously we're responding to a lot of different requests across the state and would love to see you be able to access that information as soon as possible. One of the things that somebody told me a week or so ago was that I should always keep my eye on the ball and make sure that I'm making decisions to actually do good, not make decisions that just make people feel good, that I actually focus on making sure that every decision that I'm doing will do good for the people that live here. And that has been one of the things that I think about quite often when it comes to pivotal moments where we're protecting people's health. With that, I will open it up to any questions that you may have for me or for the Secretary today.
I have a question. We received a press release from the Labor Department today, and it said that, I guess the end of the question is, so they said that people are, they've made calls for people to get jobs and people are refusing, which means that there could be fraud and all that kind of rigmarole and stuff. Do you know, so my question is like, what kind of jobs are safe enough to go back to right now, and is that really like, is that a problem?
You know, I would say the vast majority of the businesses in South Dakota that are still open and operating today have made it safe for their employees to be there. You know, there's been some concerns, I think, with the unemployment benefits if people would actively go out and seek to fill jobs that are there. I believe the people of South Dakota want to work and are used to working and have always worked very hard. So there are some job postings. The Department of Labor does have those. If people want to reach out to them, they could help connect them. Other questions? Yep.
Our question, is the Post's characterization of South Dakota as a hotspot fair? And related to that, I mean, I just wanted to, you said that a shelter-in-place order would not have impacted Smithfield because it would be exempt, correct?
Correct. It's a critical infrastructure job or plant as defined by the federal government.
Okay. And if a city or a county in South Dakota wanted to issue a shelter-in-place order, you're saying they have the authority to do that?
It depends on their local ordinances and what they have for laws at the local level.
Okay.
Now, I know the City of Sioux Falls has pursued some new ordinances. I'm not sure if they give them all the authorities that they're looking for. We brought a bill during the legislative session to give counties some of the authorities that cities already had. That bill failed. It was not supported by the legislature and did not move forward. I know the mayor said yesterday in a press conference that he had some of his opportunities to take care of the situation stripped away from him. There was no tools removed from cities during this legislative session. There was an opportunity to add some authorities to counties, but that bill did not pass.
Okay. And in regard to the Post article about South Dakota being a hot spot, what's your reaction to that?
I think it's fair to say that Smithfield started with some COVID-19 cases, and we've seen spread. I believe a lot of the spread we've seen the last day or two has been more at home and not in the facility. The mitigation measures the company put forward were very good and comprehensive, and I believe make it a safe place for employees to be. But I do know that it's fair to say that that plant right there is a situation we need to take seriously, and we are taking seriously, and that's why I laid out the plan of exactly the action that we're partnering with to get it back up and running and make sure we're taking care of employees and their families. I've talked several times over the last 24 hours with the Vice President, with Sonny Perdue, the Secretary of Agriculture at the federal level, with Ken Sullivan, who is the CEO of Smithfield. We're working on a plan to bring that plant back up online when it is appropriate. And I appreciate all their efforts to make sure that we have the supplies, the testing, the PPE, and the employees ready to go when we can bring that plant back online.
If revenue is so down in the state, why commit state money on the clinical trial, and how much is the state committing?
You know, we really want to make sure that we're being aggressive against this virus and protecting people, and we'll be partnering with our healthcare systems in that. And we do have some opportunities through federal bills that we can use for revenues in COVID-19 response. And it was very helpful that the federal government gave us 1.2 million doses of the hydroxy because that helped to get it up and running and get the trial running and therapeutics running at the state level as soon as possible.
This is Fran.
They started giving patients doses already as of yesterday. The trial, I'll leave to the researchers to give you details on how that's going, but it'll initially start with 2,000 people, but we do have enough therapeutics in place that we could treat up to 100,000 people in the state of South Dakota. There was a question on the phone.
Yeah, thank you, Governor. This is Fran Carr from the West River Eagle. I have two questions.
Sure.
You said that a shelter-in-place order would not have protected the workers at the Smithfield plant. Were their family members self-isolating? Because that's the only way that those workers would have been protected.
I'm not certain what you mean if you think that the family members infected the workers. The first indication we had is that the virus tested positive from an employee in the plant, and that is a critical infrastructure facility and would have been operating whether there was a shelter in place in the state of South Dakota or not. That facility would have continued to operate.
My second question is, our modeling at the paper is predicting 3,000 cases that require hospitalization by the weekend and 5,000 by this time next week. I wonder if Secretary Malcolm-Risden can talk about the capacity of the hospitals to handle the cases. Thank you.
I'm not sure what model you're referring to. That would not be the model that the three large healthcare systems in the state jointly developed so that we would be ready to have enough hospital resources in the state to deal with COVID-19. So I'm not sure where those numbers are coming from. As we've talked, the model that we're working with to plan for hospital need has a peak need of about 5,000 beds, and that peak is in mid-June. We're constantly reevaluating the data that we're using with that model and are looking to update that, and we'll be sharing information on that as soon as we have it.
Wonderful.
Governor Noem, this is Morgan at the Rapid City Journal.
Yes, go ahead, Morgan.
Have you considered banning evictions and utility shutoffs? A family in McLaughlin's last week had their utilities and water shut off, which makes it harder for them to wash their hands and keep good hygiene during a public health crisis.
What I would encourage those families to do is to reach out to us. We have resources to help, and the Department of Labor and other agencies are working with them to get their needs met. So I would certainly welcome the opportunity for you to publish and get information out that would tell those families to contact the state of South Dakota, because we do have the opportunity to come alongside them and help them through this difficult time.
But not considering that?
No, not at this time.
Okay, thank you.
Governor, this morning, Mayor Paul Tenhaken mentioned data points that the state might be sharing. Just wondering, I guess, if that's going to be shared soon or when that will happen.
Yes, we do have data points that we're working on, and we're hoping that in the next day or two we'll finish those consultations with our three healthcare systems to agree on how the model has changed. We believe it's gotten better statewide. And we may see, as I referenced yesterday in my press conference, that Sioux Falls will peak a couple of weeks earlier than originally thought, but we still will be adequately prepared to handle those patients when they come our way. And remember, all the models that are agreed to by the healthcare systems identify how many hospital beds that we will need, how many ventilators we will need, and we believe that statewide we're in a better position today, and we want to nail down those numbers and make sure they're firm, and then we'll be bringing them to you, hopefully in the next day or two.
This is Lisa with the Argus Leader, and just wondering, with Sioux Falls peaking earlier than the rest of the state, does the state believe that the facilities here in Sioux Falls will be able to handle the more capacity earlier than the rest of the state?
We do. Did you want to? We can let Kim share a few more details, but yes, we do believe our healthcare systems there will have the capacity to handle that peak. And
Okay.
Just in terms of an update, we continue to work with hospitals on an individual and regional basis so that we have a good plan to ensure that all patients will get the level of care that they need. We do have a certain number of beds staffed today. We have more capacity in those actual facilities, and we're very confident that we're going to be able to meet the need for hospitalizations for COVID-19.
This is Amy Perletti with the Associated Press. I have a question about the trial of the hydroxy. I'm just wondering, the 2,000 patients would be the clinical trial, correct? And then with the ability to treat up to 100,000 people, would that be like a therapeutic thing that wouldn't go through the trial? And if so, does that raise some safety concerns or concerns about a possible shortage of the drug for people who need it for things like lupus?
Well, I'll address the last question first. The drugs that we'll be using for the trial will not be part of the usual supply chain that will be used by people that have other needs for that drug. So folks with lupus and other diseases will still have access to the hydroxy that they need. The way the trial will work is that there are two groups that will have access to this drug. The first group are people that are positive with COVID-19 who are either hospitalized or can be served on an outpatient basis. That is by far the largest number of people that will have access to this drug. We will be monitoring for safety. It is a trial. It is a clinical trial, and so all of the rules around safety will apply. There will be some people that are positive for where this drug is not an appropriate option, and so all of those safeguards will be in place for that group. Regarding the clinical side, where it's a randomized placebo-controlled study, that will be for people that are not positive for COVID, where we'll be seeing if there's a prophylactic or preventative kind of aspect to this drug with certain populations. Of course, we'll be watching and monitoring safety for those individuals as well, and doing everything that a clinical trial requires to ensure that this is successful.
Further questions? Is there a question on the phone? Okay. Thanks so much, everybody. We'll talk to you tomorrow.